Welcome to your pre-operative checklist. Now, as you know, I'm Dr. Sinno, plastic surgeon here in Montreal, Canada, and here's Victor Hamed, your surgical nurse for your pre-ops and post-ops. Today, we want to go over your pre-op checklist. No matter what surgery you're going through, these are important steps to know. Now, if you're not getting surgery with me, please speak to your doctor before you follow these instructions. These instructions are made for my patients and the specific recovery that I want my patients to go through. So Victor, tell us, what should the patients do 3 weeks before their surgery?
So 3 weeks before your surgery, start by making a list of the medications that you're taking. If you're not sure about them, maybe speak to your pharmacist to collect all the medications that you're currently on and come prepared, letting us know what they are so that Dr. Sinno or I can give you the okay to take them or maybe to stop them, and then have the time to speak with your family doctor if there are certain medications that need to be stopped.
This is extremely important because 2 weeks before your operation, you're going to meet with our nurses, including Victor, and he's going to be going over all your medications. There are some specific medications that we cannot take during surgery, such as aspirin or blood thinners. So you have to really speak to us prior and let us know so we could coordinate with your doctors about that specifically to make you have the best surgery and be safe. Now, 2 weeks before surgery, you're going to come to see Victor, and we're going to go over again this checklist, but we want you to kind of understand this checklist before you come to his consult. You want to tell them about the Amazon store that you created?
Yeah, so I've made a curated Amazon storefront with some of the top products that I think are essential for your plastic surgery journey to help ease your recovery. Some of them are more pertinent to certain surgeries and some of them are pertinent to others. So I'll tell you about them once you come to our appointment together.
Perfect, perfect. In your pre-op visit, Victor will be going through a lot of these information, so you don't have to memorize anything. It's all written in a document, 35-page document that I wrote myself for you. He will also give you our emergency cell phone number that he proudly carries for your own safety. So Victor, do you want to share with them when they should call you and when they should not call you?
So you can call in case of if you think something is urgent, if there's pain that's unmanageable with the medications that you're been given, if there's some excessive bleeding that you're not sure about, if you have questions concerning the medications themselves or the garments themselves, we can always help you with that. And then if you need to speak with Dr. Sinno, I can be the liaison between you and him.
Basically, we're always here for you. You're our patients pre-op, during surgery, and for life after. We're here to take good care of you. Please don't abuse the system. So if you have constipation, it's 3 o'clock in the morning, don't call the nurse and wake him up. I tell this to all my patients, but nonetheless, he still gets calls that he probably shouldn't have gotten calls in the middle of the night or evening. If it could wait until working hours, please wait until working hours. The bottom line is, if you feel like you need to go to the emergency department, before you go, speak to Victor, use the emergency line. Maybe we could help you, prevent you from going into the emergency. And unfortunately here in Quebec, as you know, there's hours and hours of wait, up to 30 hours. They may just tell you, go back to your surgeon. So we are giving this service to our patients. It's a VIP concierge nursing line there for you. It's a privilege. Please act like it's a privilege, but it's there for you whenever you need it. Okay.
Now, doctor, I think it's important for our patients to know that 2 weeks before the surgery, although we've probably told you during your consultation, but you really have to stop smoking. Complete cessation of smoking, and Dr. Sinno often tells our patients, if you're stopping now, why continue after? So maybe this can be your sign to stop forever.
As you know, I don't operate any patients that smoke, so 2 weeks before surgery you have to stop. 2 weeks after surgery you have to stop, so you're stopped a month, you stop forever. The reasons why this is so important is because it increases complications by 30% in some cases. Wound dehiscence infections, it's really a horrible, horrible thing to do if you're getting surgery.
Also important to note, 1 week before the surgery, they need to stop drinking alcohol, and then 1 week after surgery, correct?
Correct, perfect. And that's because it helps, sometimes alcohol thins the blood, so you may get excessive bleeding during surgery or even bruising after, so your healing is much longer and delayed.
Also, a lot of our patients are on several supplements such as magnesium or vitamin E or fish oil, so all those should be stopped before the surgery as they thin out the blood and can cause more complications during and after surgery.
Yes. Now, you have to know that if you are getting a surgery with general anesthesia, you have to be picked up by someone else. We can't send you in a taxi or an Uber or whatever it is. It has to be someone that knows who you are and who could take care of you. This is for your own safety.
You can arrive alone, but you need to leave with someone that you know.
Yeah. So after the surgery, everything's going to go fantastic, as it usually does. and you're going to go home either the same day, 2 hours after the operation, or the next day, depending on the procedure. 24 hours before your surgery, the day before, what should you do? Victor, tell us.
Start by trimming the hairs. If there are any hairs on the body of the surgical site or in the nose, for example, do trim that area 24 hours so that in case you get a little cut or bleed, it heals by the time you're doing surgery.
So trimming, not shaving, is what we want of all the surgical sites. Sometimes we have to put tape, and you don't want us to be removing the tape when there's a lot of hair there. And it also obstructs the vision for me to be able to do proper surgery for you. Remove all jewelry, please. Don't come with all your jewelry into the OR, and then you have to spend hours removing that ring. Please make sure that all that's done before, earrings, necklaces, whatever that is.
Now, doctor, if somebody has a permanent piercing, what can they do?
Yeah, so obviously let us know 2 weeks ahead. It depends on what surgery you're getting. Sometimes it can be okay. The risk is always that it can lead to burning because of electrocautery during surgery. So we want to avoid that, but we have to know about it beforehand. But for instance, if you have titanium plates or screws, that's fine. But we're talking about external on-skin piercings or
aesthetic piercings.
Aesthetic piercings.
Or sometimes a lot of our patients have fresh piercings in their ears that they cannot remove, otherwise it will close up. So sometimes we can put a tape around it during surgery to just prevent the burning.
Yeah. Eyelashes for the ladies. Extension eyelashes sometimes can go into your eye. So my humble opinion is try to remove the eyelashes before the surgery. It's much more hygienic for you to do that, and you will not lose those eyelashes that you took a lot of time to put on. So if you can, remove your eye extensions if you're getting surgery in the face.
Also, it's important to remove all makeup, all creams, all, like you said, jewelry, as well as your nail polish on your fingers, correct? At least one finger. Yes. If you can, if you want to remove them all, then that's even better.
Yeah, we need to take your oxygen saturation during surgery, so we can't have this thick gel or shellac on your nails. We won't be able to measure how much oxygenation you have while you're sleeping.
And doctor, if they have just a clear polish, is that okay?
Yeah, most of the time, even the thick gels are okay. But you want to be safe, you want your surgery to be, you want everything on your side, remove that nail polish.
And can they remove only on their toes and not on their hands?
Yeah, so that's also something that can be done, but again, we prefer the hands as well. So just imagine, we always plan for the worst and hope for the best. And that's why, and I'm going to knock on wood now, our complication rate is extremely low, almost none, because that's what we do. So God forbid, imagine that something goes wrong and we can't get a pulse on your feet because the feet are cold. So what are we going to do? We're stuck. So that's why give us at least a finger or two. In the best case scenario, remove all of it. You'll put those beautiful nails back in 2 weeks after surgery.
And now for body surgeries as well, you're going to be prescribed an antiseptic wash to wash yourself with the night before or the morning of the surgery. So when you do receive it from the pharmacy, try it on your forearm to see if you're getting an allergic reaction or not. If you find that you're not allergic to it, then go ahead and wash yourself with it. If yes, we recommend you wash yourself with a gentle baby soap that is probably not scented, is best, yeah.
Perfect, yeah. That's what I use at home, organic soaps. If the ingredients are so many that you could barely read them, or if you can't read the words, that means they're chemicals and they're probably not great for you.
Also, no exercise or sex the night before the surgery. Why, doctor?
So I've had patients in the morning of surgery, they go and they do a huge workout. So when you do a huge workout, you're in a catabolic state. Your body is being broken down. It has to repair itself. And now you stress the body with a surgery. So it's like a double effect. Number one, you've lost the effects of the gym because you won't be able to build those muscles. And number two, your body doesn't have the energy to be able to heal from the exercise. The body doesn't have time to heal from the surgery. So really relax as much as you can the day before, the morning of. You want to be in a Zen state. I understand that surgery can be extremely nerve-wracking for a lot of us. I've had multiple surgeries in the past. I know how it feels. But do know that you're coming to me because you have the trust in me, and that's a privilege. We are here to take good care of you. If you need anything, we're here for you. Think of that stress. Instead of framing it in your mind as anxiety, frame it as excitement. This has been scientifically proven that anxiety and excitement is the same physiologic response. you have the same hormones that are secreted, you have the same bodily functions that change, sweating, the voice becomes a little bit high, your heart starts racing. That's how you know if you're a rock star, you're ready to go up on stage. And that's how you know if you're a public speaker who has fear of public speaking, you can't go on stage. It's the same feeling, it's just your mindset, how you perceive the feeling. So perceive it in a positive way and you're gonna have a positive outcome.
Now, of course, a lot of our patients are going to be nervous before the surgery. Some of them it's their first surgery ever, either aesthetic or non-aesthetic. So, I mean, it's normal to be nervous before the surgery. We recommend you do some meditation the night before or pray. We also give you some calming medications if that helps as well. So we're here for you to help ease this procedure as much as possible.
The day of your surgery is here. This is the day that you're going to be starting your aesthetic journey and you're going to have the body and face or whatever you're getting that you want. Now, this is obviously very, very nerve-wracking, but you also know that you have trust in me and I'm going to take good care of you, me and my team. Victor, what specifically should the patients do when they wake up?
Now in the morning, sometimes if you're doing general anesthesia, we ask you to be fasting as of midnight the night before the surgery. You may have some medications to take the morning of the surgery, so when you do take them with a small sip of water. Maximum a quarter cup of water, not more than that. Otherwise you're going to be, hopefully not, but vomiting it during surgery. When you come to the surgery, bring with you the Sinno bag that will be provided to you during your pre-op with me. And bring with you all the medications that we prescribed to you as well as the garments that you've been given.
Wear something comfortable. You don't want to be wearing heels and something super tight and you want something like jogging pants, relaxed. And before you come, we do recommend that you take a shower with our surgical soap. It's an antibiotic soap. It really can minimize risk of infection, although I don't even remember last time we saw an infection. It's very rare, but nonetheless, put everything on your own side.
Again, no creams, no face creams, no perfumes, no deodorant, no jewelry, no makeup, none of that. Really, you should take your shower, wash your hair, and come as you are to the surgery.
As God has created you.
Also, if you're a glasses wearer, wear your glasses instead of putting in contact lenses. And if you do have your period during that week, put a hygienic pad instead of a tampon.
Perfect. And make sure you come to the right address. Our address is in Westmount for the surgery, and for all the pre-ops and the follow-ups, it's in Donamantan in the downtown area. Congratulations, your surgery is done, the results that you want are there, and everything's finished, but your healing is starting. So the healing starts right after the anesthesia. In the first 2 hours, you're going to be with our highly specialized trained nurses for your recovery. You're going to usually stay with us for a minimum of 2 hours if you underwent general anesthesia. If you did a local anesthesia surgery, then usually you stay with us for around 15 to 20 minutes. Now remember, in those 2 hours, you're waking up again. The nurses are also checking your vital signs and teaching you again how to put on the garments, how to change the dressings, and going through all the medications again. Even though Victor has spoken to you about it and our VIP pharmacist has explained to you, we're going to again explain it to you the day of. And when your partner or your loved one comes and picks you up, we will also explain it to them if need be.
Now, God forbid, after you go back home, something major happens and you feel like this is an emergency, please do let us know in advance. And Dr. Sinno and I will let you know if this is worth going to the emergency room or if it's something that we can deal with in clinic. So doctor, what are some signs of someone needing to go to emergency?
Yeah, so we all have to use our common sense. If you feel like there's something majorly wrong and you have to go see a doctor in the emergency and wait 30 hours, that means probably it's an emergency. So anything related to severe pain that's increasing and not decreasing with time and the medications are not helping, call us. If the area of surgery is swelling up, tripling, doubling and tripling, quadrupling in size in 15 minutes within the hour, call us. That's not normal. If you're having severe chest pain or you have loss of movement in one side of the face or body, those are abnormal signs as well. So anything, just use your common sense. If you are feeling a little pain, of course, there can be some pain in some surgeries, not all. But if you have any doubts, call us, contact us, we're here for you. Now you're at home and your surgery is finished. What do you do when you're home? We want you to relax. This is the time where you should be healing. So we want you to eat. We need some nutrition, but we want you to eat at least 2 hours after surgery. Don't rush it. We don't want you to vomit. So eat something also light, easy, like soups, broth, high protein content. We want you to be having 1 gram of protein per kilogram per day at least. Multivites, vegetables, fruits, that's all great stuff. Avoid the junk. Avoid anything deep fried, heavy. We don't want you to be vomiting the medications, increasing your blood pressure that may, God forbid, cause a bleed after surgery. Now the bed is meant for sleeping only, okay? So you sleep at night, you go to bed at night. If you want to elevate a body part, then you can use the bed, but I don't want you to be there all the time. We need you to be moving at least every 2 hours during the day. If you're static, you're going to be swelling more, you're going to be showing more bruises, and your recovery will be delayed. So move, walk, but only if you feel up to it and you're not feeling dizzy. You could go up and down the stairs, but only if you feel like you're strong enough. If you want to have someone with you that's helping you, that makes good sense as well. You want to also be avoiding caffeine. Caffeine can constrict the vessels, can increase blood pressure. So my humble opinion is avoid caffeine for 2 days. But if you're a person who gets migraines if they don't take the coffee, then I don't mind you drinking your 1 coffee a day.
Pets as well should be avoided, doctor,
Yes.
in case they jump on you or they're very happy to see you and your dog goes onto the surgical side and causes some trauma or injury. We don't want that, as well as infection if you don't wash your hands properly after touching them.
Yeah, I love animals, they're amazing. Even kids, you have to kind of be aware of your surroundings during surgery, but not just because of the physical trauma that they may instill on you, but also for the hygienic issues. So you want to avoid places where there's a lot of fur, for instance, or hair, because it may cause infections.
Now, although we're telling you to move around and stay active, don't start doing house chores or being too active. I say during this time, honestly, just take it easy, Netflix and chill, watch some movies and rest well. After day 3 from the surgery, you can start driving. Of course, if you're not taking your morphine or pain medications,
Yes.
You can also start traveling for distances of less than 2 hours by plane, and you can start showering. When I tell a lot of our patients to shower after 3 days, they're a bit scared. Is it okay for them to shower after 3 days, doctor?
Yes, so you could take off the dressings and the nurses will show you what dressings and how you can take them off. It's very easy. I don't put big bulky dressings. They're very easy to take off. You could go ahead and shower. Epithelialization, the skin is closed within 24 to 48 hours, the epidermis. It's not solid, it's not strong, but it's closed, it's watertight. Even if it wasn't watertight, even there were small openings, if you have running water and soap, it will decrease bacterial count, contrary to what we think it may cause infection. In fact, it's the opposite. But we don't want any baths or pools or rivers or lakes. You want to avoid that for at least 2 weeks. But running water and showers is fine if you feel up to it, but not too hot. We've seen this before. If it's very hot, you may get dizzy, vasodilation, and you may fall and hit your head. We don't want that. So you want a nice warm shower if you're feeling up to it. If you're feeling dizzy, avoid the shower, just do a sponge bath. Elevate the area that you had surgery in. For instance, you had surgery in your head and neck area, you want to be sleeping with at least 2 pillows. You had surgery in the leg area, you want to be raising the legs above your heart. Anywhere that you had surgery, you want to try to bring it above the level of your heart as much as you can. Now, that doesn't have to be 24/7, but at least at night, yes, you want to keep it all night. And during the day, you want to be walking, moving, and then elevate that area as well. If you're having specific surgeries such as a tummy tuck, Victor will talk to you about that. You want your hips to be flexed around 10 degrees at all times minimum. So if you're sleeping, if you're sitting, you're at 90 degrees, so you're fine. But when you're sleeping, you have to put a pillow under your knees and pillows behind your back to be able to get that flexion.
And now, doctor, if somebody's super uncomfortable during their sleep because of the elevation or because of the pillows, should they just sleep flat, knowing that rest is important, or should they kind of sleep elevated and affect the sleep?
Yeah, great question. So the most important thing is sleeping, because that's when you actually heal. When you're relaxing, you're not injuring yourself, but when you sleep, the body really heals itself. So we want you to be sleeping well. Now, I don't mind that you sleep flatter in specific surgeries if that means that you're going to get a better night's sleep.
Now it's day 7 after your surgery, or day 5. This is your first follow-up appointment with the nurses. Dr. Sinno is not present at that appointment as it's only a medical appointment. We're taking a look if your incisions are closing properly, if God forbid you have an infection going on, or if everything is just looking as it should be at this point. If there's stitches to be removed, we will be removing them for you, and then we will adjust your garments accordingly.
Yeah, so infections are usually what pops up at day 5 to 7 time. Bleeding happens in the first 24 hours, and that's what we talked about. If you have increased swelling, you let us know.
Now after the 1 week follow-up, you don't need to sleep elevated anymore. And if you still have steri strips on your incisions, after 1 week from the first week, you can start removing them slowly in the shower. They're usually fall by themselves in the shower, but if they don't, then do remove them by yourself. And then after that, you can start applying the silicone gel that we've prescribed for you.
Yeah, elevation after 1 week is not usually recommended, and even icing after 1 week. If you want to minimize swelling, you could also put icing. And for specific surgeries, we do recommend hyperbaric oxygen, but Victor will be talking to you about that the day after surgery. 2 weeks after your surgery is here. Now you're presentable to the public most of the time, and you're able to really become much more yourself. But you're not perfect yet. Don't fight. Pain at this point means damage or injury, so don't push it. By 6 weeks, you're able to do everything. So at 2 weeks, I tell my patients, you could do some slight lifting if you want, exercises, 25% of what you usually do, just to be able to be more mobile. How about sex? Sex, I tell my patients, this is the time where you want to be making love. You don't want to be having that crazy sex. You want to be kind of relaxed. You could enjoy your partner, but don't go too crazy when you're doing it until the 6 week mark.
Now, doctor, in those 2 week marks, are our patients allowed to have orgasms?
Yes, of course. Orgasms are fun. Enjoy them as much as you can. Just to get to that orgasm, don't go heavy exercise type of situation where you're going to be increasing your heart rate and, God forbid, losing control, opening up the incisions. We want you to kind of make love at this point.
So at what point can our patients go back to the gym? 4 weeks, 6 weeks?
It really depends on what procedure you're getting. So if you could specifically ask us, but most patients, I tell them even at 2 weeks, you can start exercises. But at 6 weeks, you could do almost anything you want depending on how you're healing.
And listen to your body as well. If you're feeling some pain or sharpness, then go lower on the weights or less intense in the exercise.
Absolutely, great advice. Now it's 4 weeks, 1 month has passed and you're feeling so much better. If you did have fat grafting surgery in the cervical site, now you could put pressure on that area because at the first 4 weeks you were avoiding putting pressure because you could lose that fat. Whatever fat you have at this point is fat for life, so enjoy it.
Now it's your second follow-up after 6 weeks from your surgery. At this point, you can go back to normal life as if nothing happened. You can go back to the gym, start swimming, having regular sex, and stop wearing your garments altogether. And then you have your third follow-up appointment at the 4 to 6 month mark, and then you have your final one at the 1 year mark if it's not a rhinoplasty, and if it's a rhinoplasty, then you have your final one at the 2 year mark. During this entire period, we ask you to keep applying sunscreen on your scars, especially if you're exposing yourself to the sun, even under your bikinis or your clothes, because UV rays do penetrate tissue. So keep your scars nice and covered. Like that, they will heal into a nice pink color and then hopefully turn white, so then they will be invisible.
Thank you for listening to this video. I know it could have been a little bit long for you, but it's extremely important. It will help you heal much faster than you could have otherwise. So we are looking forward to taking good care of you and being part of your aesthetic journey.
And if you need to re-watch this video, watch it as many times as you need to. It's here for your disposal. And if you have any questions, come prepared to your preoperative appointment with me, and it will be my pleasure to answer all of them. Bye-bye.